Hi, I am Dr. Raghav Malik, consultant, cataract, refractive, and cornea surgical sciences at Center for Sight. Today, I'll be discussing about a very commonly asked question to me by my patients, that whether they or patients can get a refractive surgery or a laser done in case of a keratoconus. So, what is keratoconus? Let's discuss that first. So, what happens is that, let's say this is the front of the eye, right? So, the front of the eye is known as the cornea. It's a transparent structure. So normally this cornea is absolutely transparent like this. It is placed in front of the eye and it acts like the window to the world. So all the light that goes through this cornea actually travels through it. It has to be 100% transparent. In case there is any loss of transparency, the light cannot go through it. So this is a normal shape of the cornea. If you see, it is like this round. But in what happens in keratoconus, it actually becomes conical shape. So keratoconus comes from two words. Kerato means cornea and conus means a cone shape. So the cornea, which is supposed to be like this, becomes like this. It becomes conical shape. So now you can imagine that something that is supposed to be circular becomes conical. Because of this change of shape, once the light hits the cornea, it goes in different directions. So what happens is the light that is falling inside the eye is not falling at a single focus and it is very blurred, right? So again, in simple words, if this is the cornea, so the cornea is made up of multiple fibers that are placed like this and are supposed to be in this shape. But in keratoconus, they become weaker and they go towards the outside and make a conical shape, and these fibers become weaker, right? So two things are happening. The cornea is becoming more steeper or it is becoming more conical and the thickness of the cornea decreases. So these corneas are classified as keratoconic corneas and they are very, very weak. So if you have been diagnosed as keratoconus or a keratoconus suspect, in such cases doing a refractive surgery is a big no-no. So you cannot go in for a LASIK, you can't go in for a Contoura LASIK, Contoura, a PRK, a smart surface, a silk or a smile for any cases that have been deemed a keratoconus or a keratoconus suspect. We do have some options, some laser based options that we have to treat in such cases that can give you some better. So I'll go into some detail and try to make you understand that what can be done for such eyes. So you have to understand the cornea, which was supposed to be like this, has become this. So now there is no way for us to get the cornea back. That is impossible. We cannot put the cornea back to its shape. Now what we have to do is that in keratoconus, there are two things which we have to do. One is that we have to stop the cornea from deforming more. That is, the cornea that is circular or a bit spherical has become conical. We want to stop the disease as this stage itself. So to stop keratoconus, there is a procedure known as a corneal cross-linking. Right? I will not discuss in detail. You can look at other videos to understand what a corneal cross-linking is. But the cross-linking will actually just stop the cornea from going into a further or a more advanced stage of keratoconus. So that is one way of stopping keratoconus. But the second part of keratoconus is how to increase or better the vision. So to better the vision, there are multiple aids that we can do along with cross-linking. We can use contact lenses. The contact lens will go on top of the cornea and make the cornea a bit more flatter, giving you better vision. And also we can do something known as a TREK and a TCAT. So what is a TREK and what is a TCAT? So TREK, T-R-E-K, stands for Topography Guided Regularization of Epithelium for Keratoconus. T-R-E-K. So this is for cases of keratoconus that are very, very advanced, where the cornea, which was supposed to be like this, has become like this. So what happens in TREK cases, we can just, the topmost part of the cornea, which is the most uneven part, we can just give a very small amount of laser and just smoothen that. That is known as TREK, and immediately after that we have to do a cross-linking. So the advantage of this is that the cornea, which was very, very irregular, becomes regular, and we have stopped the disease. That is for very advanced keratoconus. But for cases which are moderately severe or a mild keratoconus, we can do something known as a TCAT. TCAT. TCAT stands for Topography Guided Customized Ablation Treatment, which can be used for keratoconus. In TCAT, what we are doing is that the cornea which has become irregular. So not only are we shaping the cornea, we are also actually just reducing the number of it. So in keratoconus eyes, there is a very high cylindrical power. So in such cases, we can decrease the cylindrical power by maybe about 10 to 15% and then immediately do a cross-link. So the advantage is that we have stopped the keratoconus and also decreased the power and also resurfaced the cornea so that the vision quality improves. So now you may ask that if I am not able to get my glasses removed, then what is the point of a track and a TCAT? So the advantage is the cornea becomes regular. You may have lesser dependency of contact lenses after these procedures. You may have a better vision quality at night, which is very, very important. Patients of keratoconus at night have very disastrous vision. They have lots of halos, lots of glares, and they are unable to drive. So they are dependent on contact lenses. So after a TREC or a TCAT, you can have a more regularized cornea so that your dependence on contact lenses decreases and you can actually have a better quality of life. This is a boon that is for keratoconus patients, but not everybody is fit for it. You have to do some tests to know whether you are fit for a TREC or a TCAT or not. And for very advanced keratoconus cases where we have a very high power, after doing a TREC or a TCAT, we can actually do something known as an ICL or an implantable contact lens that can decrease the power. For patients with keratoconus with very high power, we can actually decrease the power and give the patients a much more spectacle independent life.
Follow Planet LASIK and post your queries to get answers from the experts.